Hi, I'm Dustin. I'm a respiratory therapist and a respiratory therapy coach. I've had some patients come to me who ask me, I'm having trouble breathing, and my dentist said that I have a small mouth and my teeth are crowded, and that might be affecting my breathing. Is that true? Are they onto something? Well, yes. So, pulmonary and sleep studies and dentists have discovered that the size of your mouth and the crowding of your teeth, especially if you have an upper bite where your upper teeth are landing before your lower teeth, can actually cause breathing problems. And for some people, sleep apnea. Let's go over the anatomy. Your airway is made up of your nose, your tongue, your jaw, the palate, and your throat, meaning your larynx. And your esophagus is involved as well, but that depends on if it swells up. It can actually affect it. But we're going to focus on just the airway itself. So research has proven that the size of your palate and the crowding of your teeth affects your breathing because the location of your tongue. When we sleep, we relax. Our jaw normally relaxes, and our tongue will drop and fall back. Especially if we arch our head too far back, our tongue goes back even further, and then our airway relaxes and narrows a little bit because our muscles are not as taut. Taut meaning, activated. So this can lead to partial collapse and snoring. Snoring does not mean you have that sleep apnea. It means your airway is being narrowed and you're hearing a vibration sound. Got it? So what happens over time, it can lead to sleep apnea because the airway gets so narrow it stops and you wake up. They call that obstructive sleep apnea, where you're not breathing. What this does to your body over time is it decreases your oxygen. Poor sleep, your stress hormones go up, your cortisol, your fatigue increases, brain fog, and mood changes. And guess what? All that affects your heart. Blood pressure goes up, your heart rate goes up. That's not good for you. So when they come to me and like, hey, why do I have these problems? Well, one is genetics. Got it? Some people are born with smaller mouths. You can tell my mouth is small, the way my face comes in. Other people have big mouths, but also it's environmental. You have to be aware of that. There are some things in your environment that can affect it. That would include chronic mouth breathing in general. Can eventually lead to the same problem. Eating soft foods a lot, especially when you're young, can underdevelop your jaw. Good chewing habits are very good for your mouth as well, and using proper tongue position. Let me explain. Your mouth wants to chew evenly back and forth, and then relax in between with a gentle relaxing of your jaw, your lips slide together. You're chewing. See how my teeth are landing equally? Not equally, and your lips are closed. Your jaw naturally relaxes in between. A relaxed jaw, lips together, and your tongue behind the back of your teeth, or the top, allows your mouth to open up and your airway to open. When you don't do that, for example, you're chewing like that, it stresses the jaw muscles, increasing tension in your throat. That tension can lead to a small airway over time, and the mouth breathing leads to mouth breathing during the night. It's all about when we do it during the day helps us at night. So why is it so important to breathe through our nose? Well, research has shown you are 80% more efficient breathing through your nose. And it increases more nitric oxide and even dopamine. Ooh. And our favorite is serotonin. Also, it helps filter the air, increase the humidity, which is so important for your lungs to keep the mucosa nice and moist and not dry and cakey, no fun. And it warms the air. Right now, I'm currently in Iowa, and so the air is dry and cold. Sometimes it gets warm, but it's still dry, and that is hard on the mucosa lining of your lungs. Most of what I do is I make sure I am nose breathing, and if I need to, I take adequate amount of water. And if not, I add a little lubrication to my nose to help increase the moisture in my nose and my airway. So mouth breathing has been shown to decrease your CO2 oxygen balance. It can lead to snoring. It can lead to crowded teeth just by mouth breathing. Dry mouth makes sense. You're breathing through your mouth, right? Fatigue. You're more tired when you breathe through your mouth. When you hyperventilate, you breathe through your mouth just to get the CO2 in balance. But in reality, what you really need is to breathe through your nose only to help you breathe and relax and recover. Fatigue. Yes, you're more fatigued when you breathe through your mouth and you talk a lot. Hey, how's it going? And you don't stop in. Make sense? Poor sleep, brain fog, walking with this technique will not help. You need to breathe through your nose when you're walking to keep your body in balance. It can also lead to jaw and neck tension by breathing through your mouth. It doesn't allow your jaw to relax because you're always open, always open, always open. Relax. So why do doctors like pulmonologists after sleep studies say you need a CPAP machine? CPAP machine is like a pneumatic airway splint. Pneumatic means flow, and its splinting means opening up. So your airway starts to collapse due to all these different factors we talked about. You then can give it flow to help it stent open. Wow, and that improves your ability to receive your oxygen from the atmosphere. We get about 21% of oxygen from the air, and this is how it allows us to get it in and gets that cellular energy we need, which of course will improve your mood. You have more cellular energy. Your heart health will improve. Your brain clarity will improve. Your sleep quality will go skyrocket. So CPAP is a tool. Some people might say, if I need CPAP, something is wrong with me. Not true. Sometimes the airway anatomy simply needs support. We want to stent open the airway to allow that quality oxygen to come in. And over time, you can actually decrease the usage of the machine. That's why we titrate the pressures. The doctor prescribes the pressure, the respiratory therapist applies it to your machine, and from there, you guide the doctor to what you think works best for you over time. If you start off at 15, you're like, you know what? This is working, but I think I can go down because the pressures are just too much and I'm getting good sleep, but it's just too much to tolerate. So doctor, I like the machine. I'm going to use it, but I just feel like the pressure's too high and I don't want to use it at that pressure. Can you help me out here? That's a great place to start. One other thing we definitely need to avoid with all breathing concerns is remove toxins from our lives. Avoid smoking, vaping, harsh cleaning chemicals like bleach. Poor indoor air quality. If you need to add an air filter or allow fresh air to flow through your home. Indoor air pollution is a very common problem for inflammatory response to your lungs. Continue nasal breathing. And also, this high quality water will help improve the lung quality of your body. But we all get sick sometimes. So remember, you can still use clean air and humidity, water, and immune support to help us get through our day-to-day nasal and lung concerns. Improving your oral health is pivotal to lung health. One way in, one way out is how I say with the breathing. So it goes in your mouth, it can go in your lungs. So good oral habits, good tongue cleaning, actually very important. Quality hydration. Treat gum inflammation. If you have to go to a periodontist, get it fixed. Or you can try oregano oil on a small dosage, either on your fingertip and rub around your gums, or on a toothbrush with your added toothpaste. But remember, oregano oil is very powerful and has been shown to help with gingivitis. But remember, it is a strong product, so use it sparingly. It does a lot with a little. And this helps decrease inflammation and bacterial load, which can eventually lead to your lungs. Okay, another option you can do is garlic and oregano oil capsules have been shown to decrease the biofilm on your teeth, which can lead to some people increasing their pre-diabetes-like symptoms and leading to different cancers. Biofilms are basically bacteria that has been pounding up over time on your teeth. And you need these strong antiviral, antibacterials that are natural that you can use in your gum lining through oregano and garlic oils. Next thing you can do is boost your body's natural nutrients by eating quality whole foods, quality fruits and vegetables, quality meats. Those are the good fats, all that stuff you need. And hydration, and also trying to cut back on a lot amount of sugar, because a lot of sugar increases the biofilm in your teeth. Got it? And can lead to inflammation. Alcohol, try to cut back on your alcohols as best as you can. I recommend none, okay? Whole goal is to help regulate your body's inflammatory response and help your insulin be normal. No high and lows, okay? Nice, normal insulin. Nutrition you can add of nutrients is you can add magnesium glycinate. It helps your nervous system support and supports quality sleep. D3, this helps your immune support and mood support. Zinc helps with immune and tissue support. Vitamin E, antioxidants. CoQ10, cellular energy. B12, nerve and energy support. And omega-3 fatty acids. Very good for anti-inflammatory support and cardiovascular health. Next, please move. Train your body, exercise, yoga, tai chi, walking, lifting, resistance. All these are very good for you, but remember, breathe through your nose, out your nose. Now, when it comes to stress and mood, breathing is very important to regulate. Stress hormones like cortisol can be altered to the way you breathe. And also your mindset. Your mind and your breath are directly linked. Okay? Now, the whys is also important because there is a connection between your brain and your heart when it comes to quality sleep. Sleep apnea affects more than just sleep, as we all are learning today. It can lead to airway obstructions that cause heart challenges. Airway affects your heart? Well, because of the lack of oxygen. That cellular energy puts stress on your heart, which makes the heart work harder. So the pressures go up. The oxygenation you need goes down, which also affects your brain. So your brain gets less oxygen, and the blood vessels will restrict. Makes sense? Because they're working harder. We want to improve all of this. So your energy goes up, your mood gets better, your heart gets better, and you feel mentally clear. The bottom line is your airway anatomy matters. Small jaw, crowded teeth, mouth breathing, and nasal obstruction can absolutely affect your sleep, oxygen, your energy, your mood, long-term health, but there are many tools that help you guys. Nasal breathing, clean air, better nutrition, exercise, sleep support, and overall oral health improvement. Your body's deeply connected. You sleep affects your day. Your day affects your sleep. Your nutrients affects your body. Your stress affects your body. It's a lot to think about, but in reality, it's one simple thing. Breathe in and out. That's it. Slow things down. And remember, you have control. It is a pleasure to help you bring health to your hands. Thank you and God bless.